Welcome to the Healing Soul podcast, empowering wellness and oneness. I'm your host, Marybeth Rombach Nelson, and I have an amazing guest today. I'm excited to talk to Dr. Tommy Rhee. Welcome to the Healing Soul.
Thank you very much. I'm excited about this.
Wonderful. Can you tell our listeners just a little bit about your background and what you do?
Okay, so my background, I'm a sports chiropractor, and I primarily work on athletes of all levels, all the way from high school to professional levels. And it started with being the chiropractor at UCLA athletic department, and then seeing those collegiate athletes move into their world, and of course, into the professional world. And then you go into where they're going and where, these other professional teams are needing your services. So this is back in California. And then when I moved to Florida, I'm more involved with individual athletes, if it's the track and field world and tennis. So you start looking at specific like sports and their individual self into this world. So not so much a team. Now we're going to individuals, and that led me to things like the WWE and the Tampa Bay Buccaneers. And
Wow.
then throughout this whole period, you're looking at these athletes, how they recover. So the secret is that you want to recover quick as you can, so then you can get back on the field or your practice or performance at a high level. So as you progress through this period of these collegiate kids going into the professional worlds, and as they start aging, you're starting to see a common thing is that the recovery starts slowing down. So they would do things like off-season regenerative medicine of stem cell therapy. So I seen it evolve from all the way from prolotherapy to PRP to stem cell therapy to where it's now going into the topical application. So with that, you look at what are the the side effects or some of the down of doing injectables. So you hear the complaints of these athletes talking about, when you do the injections, there's a secondary injury site from the needle, and there's downtime for the actual injections to work, and the risk factors of infection and stuff like that. So during this period, I'm looking at their progress and how they keep themselves younger and being more athletic. And then you start thinking about, all right, we need something that can do this kind of vehicle of delivering these stem cells, these regenerative medicines to their target tissues. So then now it's evolving to a topical application where there's no invasive needles. So throughout this period, from all the way from the collegiates now to the professionals, and now I'm working on individuals in every aspect of their level. If it's a weekend warrior to professional athletes, we introduce this regenerative type of application.
Wow, that's amazing. So, like the average person listening, that runs or works out and then say they hurt their knee, how can regenerative medicine help them?
Yeah. So when you start thinking about that type of person, like a weekend warrior, someone that really
Right.
pushes themselves, it's about recovering. So, like, we all remember when we were younger, we can recover real fast. When we're 18, 17, it's the ability to get our cells to regenerate quickly to heal. So as we age, or we don't have that type of like a scheduled type of practice, because you always want to keep that tensile force on that tissue, but also have the ability to recover. So when we do like the typical work day or work week, we basically are not really exercising hard until the weekend comes, and then we compress real hard. So during that time, your body's not used to it, and it does that micro tearing or some type of inflammatory or something happens. So the problem is that you don't have the ability to heal like you when you're younger. So then you're having this micro tear that stays, and then you're constantly pushing every week that micro tear, and it gets bigger and bigger, and the problem gets worse. So you have to either shut your system down by not exercising for that period of time to heal, or speed up the healing process, and that's where the regenerative medicine occurs.
I love it. So, do this stem cells, like with the topical, if say I'm running a half marathon and I hurt my knee, and you were to put the topical stem cells on, does that repair the tissues quicker?
Yeah, so there's two components about that, right? So one component is that you're looking at a tissue that's an avascular tissue, like if it's a tendon, right? So you have like a tendonitis. So because the tendon is not vascular like a muscle, there's poor blood flow. There's not a lot of like nutrients going in the area to heal it. So you need to excite the tissue to open up the vessel. So you need to vasodilate. That's one thing. The next thing you want to do is you want to have the existing tissue to regenerate. You have to have a signal. And of course, as we age, we lose that ability to signal. So you need to introduce it. There's two components, right? So you have to excite it with some type of a vasodilator to bring more nutrients and open up the vessels. And secondly, you need the right signals. And some of the signals in our adult stem cells or our adult cells after 40, we don't have those bright, really acute signals. So we adopt that from those stem cells. The stem cells, what they call the EVs, extracellular vesicles, they have those signals, the signals molecule. That's why they call them cell-free. It's basically like a encapsulated like messages inside there. Like for instance, like microRNAs, cytokines, proteins that targets existing tissues that say turn on. Like for instance, your muscle. If you have something wrong with your muscle and you want to regenerate, you got to turn this thing called the satellite cells. And then in your tendon, there's a thing called tenocyte. Tenocytes make more of that tissue. You got to turn those things on. Those tissues have to have the right signal. And if we don't have that right type of information, well, you better get it from somewhere else. And that's why these stem cells that come from the actual umbilical cord, the embryonic umbilical cord, and the tissues called Wharton's jelly, well, they have the highest vibrant tissue signal that you want. So that's what we utilize. And then you put that in the topical, transdermally goes to the skin, and then it goes to your existing tissue, and then it regenerates. So that marathon runner, they would take advantage of that. Sorry about that long way to answer that question.
See, I think it's interesting. I love science, so it's very interesting, and I'm sure it's interesting to a lot of our listeners. So, how many would they come into the office for the topical, or do you treat people online through telehealth, or how
Yeah.
does your practice run?
So exactly. So they'll come in there and they'll talk about their injuries, and then we do the first thing you want to do is use the diagnostic tools like X-rays, MRIs, ultrasound to see what you really have. Once you understand what you have, now you take the next step is all right, what type of modality or therapy you want. So if it's that type of like chronic or repetitive injury that's really addressing that tendon, well, you need to speed up the healing process. So when it comes to that component and you're looking at regenerative medicine, then they go into a topical, which is a home application. So it's just basically you have a cream that you apply on your skin once a day for 30 days, and that will yield as much as the injectables.
Wow, that's amazing because no one, I know I certainly don't like needles. So if I, if I can get a topical, that's awesome. So does it help with arthritis at all, or
Yeah,
have you
that's
studied that and how what are the results with arthritis? Like if people have arthritis in their hands or knees or joints?
yeah. So when we think about arthritis, we're looking at not so much of like your tissues being damaged by like something of like overuse. You're looking at the inside of the joint and this cartilage, this kind of lining. It starts decreasing. You're starting to beat that down. You're not looking at the outside of the joint. You're looking at the inside of the joint. So because of that trauma, you're chewing down that joint, your joint space starts decreasing. When it starts decreasing, you hear the terminology bone on bone, or I don't have no more cartilage in my knee. Well, that's what's
Uh-huh.
happening. You're eating that out, right? So
Okay,
the only way to really combat arthritic situations that have, osteoarthritis, you need to
right,
regenerate that tissue. You have to think of something to regenerate that cartilage back to its normal height so you can open up that joint space so your joint can be, it can move properly instead of like bone on bone when you hear that clunking, that rattling, that ratcheting sound. Well,
right.
regenerative medicine does that. It engages that growth factors into those types of the cartilage to grow again. So that's what you want to do. So that's the only thing that's going to really help arthritis in the joint.
That's amazing. How long have you been studying this regenerative and the stem cell?
Wow, I mean, I started in 2005 with prolotherapy and trying to really grasp what the body needs to do to regenerate. So you look at back then, it used to be a an injection of sugar water into your body, and it feels like it's an antigen. So your body wants to make antibodies or lay down more tissue because they think there's something going on there, so it wants to lay down like, more scar tissue or healing
Right.
factors in that area. Then it goes to PRP, and then you look at growth factors. So it's this is a long trail of, learning through your patients, your athletes, and understanding this. And as it evolves, you evolve with it. So then, the big thing is that there's so much great studies about mesenchymal stem cells, these stem cells, right? And then it talks about like not just like the musculoskeletal stuff. You look at the visceral stuff of like your organ tissue of your heart, liver, kidneys. They're looking at great studies about that. So the great thing about this is that it keeps evolving. So you stay on top of it, but more importantly, you just understand the principle of signaling. They call it the paracrine effect. So the paracrine effect is basically cell-to-cell signaling when the cells get near each other and they signal each other. So the neat
Right.
thing about that is that if you have like a vesicle that has no nucleus, no DNA, and just a
Mhm.
signal, well, the beautiful thing about that is that it can't mutate or it can't like transcribe into whatever it was in that DNA sequence, right? So you eliminate that, now you just have the signal. And that's really important about regenerative medicine. You don't want to hear about things like I have live stem cells. Well, you have to be careful because those stem cells have a DNA. You don't know what that's going to transcribe into. So that's why it's really important to understand about cell-free signaling, that paracrine effect, taking your existing tissue and getting a vibrant signal and to say, hey, introduce it and says, wake up, turn on, and then do what you're supposed to do. And that's really like make more of that damaged tissue.
It's a fascinating area of science, and I'm sure it will keep expanding and growing as you work in this field. I'm sure you've seen amazing recoveries of patients.
Yeah, especially the difficult patients. When you have that, you know, the classic one that we see that is tough to really manage are like people at work that have that elbow pain from overuse of the mouse. So they call it the tennis elbow or the lateral epicondyle. And it's basically when you're using the mouse and you lift up your finger and then you're extending that little digit, the finger, index finger, and you're compromising that tendon distally all the way down to your elbow. So you're always using your mouse and you start getting not so much the wrist pain, but an elbow pain. So
Right,
when it's over and over repetitive and you can't stop because you have to continue working, you'll switch hands, but then, you still have the original pain, but then you get the next pain, which is the other arm. So you
right.
have to think about a way to regenerate that tissue, or you're going to be in the brace for a long period of time. So then you see things like, all right, these are the things that you want to address, these repetitive overuse type of, biomechanics that compromises that tendon.
That's that's amazing. And then you also um, do in your practice ART. Can you explain what that is?
Yeah, AIT, so it's called active release technique. I think the biggest way to explain that is that when you do any type of repetitive movement again, or something that had damage, your body will recover and it lays down like connective tissue that heals that area. But sometimes we lay down excess tissue, and that's that adhesion between two muscle bundles, or maybe the fascia, or something that glues things together. So the idea is that every muscle has its movement, right? So one will go in this direction, the other one will go in another direction. When we have the adhesion, it glues together. Now it acts as one. So you don't have that normal biomechanics because you feel the restriction in that joint. And the joint we're talking about like the soft tissue around the joint, if it's a tendon, ligament, muscles. So now you've got to think like there's some glue that's applied on there. So with ART, what we do is that we use our hands and our job is to release that adhesion or something that's stuck in between that tissue. So then it has this different motions. We want to have it like this acts as a vertical and this acts as a horizontal, not acts as one big unit. So we take one of the tissues and we release it off the other so then it has this independent action.
So I'm trying to visualize that. Would that be like somebody that has like a frozen shoulder situation?
Kind of, yeah. So frozen shoulder is a little different. So frozen shoulder
Okay,
is think about in your so you look at this thing called the glenohumeral joint, your shoulder joint, right? So
right.
you got this ball and socket. In this socket, there's an encasing called a capsule, right? It's a
Mhm.
capsule that has been irritated or something happened around that capsule that again it grows scar tissue around that capsule, which shortens the joint. So now you don't have that full range of motion. You have limited range of motion in that joint, which is called the frozen shoulder.
Right, right.
With ART, it's very toxic in the sense that you have to go in your armpit and get very aggressive and break up that adhesion. So it needs to be done. It's one of those things that when you have frozen shoulder, there's no other therapy but aggressive, really precise movements to take that capsule and break up that scar tissue. So very aggressive.
So ART and then the regenerative medicine, a lot of times a patient can avoid having surgery and being cut open, can't they?
Oh, 100%. You think about when you do surgery, that's the last type of option you want because once you get invasive, you're talking about not only a bad outcome from the surgery itself, but you think about the ancillary things of like infection. I mean, that's the worst thing you want to hear about is I have an infection. So you want
Right.
to think like, hey, what can I do before I do the surgical route? Because once you open you up, you're talking about, you hear all those horror stories of like
Mhm.
that kind of bacteria infection or something that really like sets their recovery in a poor direction. So
Right.
when you think about like, for instance, like if you have a muscle tear, like a rotator cuff tear, now if it's not completely ruptured, if you have some of the fibers still there and it's not like a complete rupture where you can't move your arm, but you can move your arm, but it's painful. Well, think about the conservative route. Think about really regenerate those tissues to heal back normal without that aggressive cutting and going in there. So I would take the easier option with the less risk first, you know. And then when you hear about ART is a great thing to restore like the normal range of motion. So when you have that adhesion, you can break it up. The thing is that when it comes down to the secondary and the tertiary level, you may have like a shoulder injury that all of a sudden it kind of migrates down to your elbow or maybe your thoracic because you limit the range of motion in your shoulder. So you still want to do things. So you have to do something more on the other joints. And then you start compromising your thoracic area or your elbow. Then that becomes a problem. So you start making
Right.
these complicating cases when you should address the primary one first. So ART will help you alleviate that before it gets worse to the point where now you need to do surgery because now you have so much adhesion or you might have something else in your thoracic that compromised and you tore that or did something weird. So that's why you want to address
Right.
these things as quick as possible.
Right. Because your body, you tend to overcompensate and then it throws your spine off or something else off, and then you got a whole new problem to deal with. So, what is the most common injury for like weekend warriors or people that maybe over exercise? What's the most is it knee injuries or
Yeah, that's a good question. It's a lot. So, low back is number one. Everybody somehow has a little bit of low back pain, especially when you're doing that sitting around your office in the weekday and the weekend you go 100% and
right?
you hear the low back, then you hear the knees, then you hear the shoulders, and it could be even the neck. So, all the above. It's just what you're really no, if you look at it's all about the strength around that joint too. If you have a bad like imbalance of muscle around that joint, well then that joint has a poor articulation or movement because one is more dominant than the other side. So you may have that poor kind of like movement in your joint, so that could be a cause. And really like it's tough because to be a professional athlete, they have all week and the weekend to really tune their body up with recovery and working out and all. Normal people, weekend
Right.
warriors, you're not really addressing that stuff. You're just saying, all right, I just want to have a good time. Take that 2 days and have the best time I can have, and then
Right.
throw my dices and hopefully I won't get hurt, right? So,
Right.
so
Right.
it's a tough thing. So it's definitely one of those things that you have to address as soon as possible before that gets worse.
Right. So our average listener, if they are, working out like 5 times a week, at least walking a couple miles a day or running or lifting weights, what are the best ways to wellness to just be a well-rounded, not athlete per se, but just a healthy individual? Some
So
ways for wellness, like suggestions.
okay, so because of my office and what I see from like after, like if you have like a chronic low back pain or something, one of the common threads
Right.
that we see here is leg strength. You've got to get your leg strength. I always say that if you can do 100 squats straight, or you can break it up, in a period of time, but just 100 squats in that day period or that one shot through 100. Uh,
Right.
you're doing justice for your body because you want to think like if you have weak legs and you want to bend over, well, guess what? Your legs are not going to be able to hold you up, so you have to use the next joint, which is your lumbar. That's where the lumbar is compromised. So you want to think your core is a stabilizing area. You want to keep that rigid while you move the larger muscle like your legs and your glutes, move that more. So that's one thing. And then as far as like your systemic body, I always say like leg strength, exercise, but diet too. Learn about diet and how your body responds to like, you know, you have to think about like sometimes we have a lot of food that have like inflammatory responses and that's delayed. You don't find out until like a week later. So I always say like if you feel that, there's something that's going off on you but you can't pinpoint what it is, do a food sensitivity. It's a real simple test. You prick your finger, you send it in, and they'll tell you what is going on as far as foods and how your body reacts to that food. But that is delayed, so you can't really pinpoint by saying, I'll eat an apple and I'll wait a day. It's not gonna, it's gonna be like a week later when your body responds to that apple and then inflammatory response. So I think that's the key thing is that leg strength to me and diet.
That makes sense. I mean, if you, I did a half marathon like 4 years ago, and my leg muscles are still strong. I kept that, and it makes a big difference. I do yoga, and I'll go for hikes up in the mountain, and leg strength is so important. And I almost feel like it, in a way, doesn't it protect your knees?
Absolutely. It depends on what kind of leg strength. You want to make sure you're doing leg strength the right, like the way you don't want to do that ballistic high jump, high, like almost like the
Okay.
plyos, right? Those are really taxing to the joint. But if you do like those simple like body weight squats, stuff like that, you're
Okay.
fine. You just be in a good biomechanics, learn your good techniques, and then you'll be fine. It's all
Okay.
about, getting the right techniques and don't go too crazy. Like you remember, like when I was younger, I was able to jump off a roof and no big deal. But now it's like I have to question about these steps. I'm like, wait a minute, what's going to happen here? So,
Well, yeah, when you're invincible before, like up to 18 or even 21, your body can just heal so quickly. And then when we get older, we've got to still stay active, but do it in a common sense way, right?
yeah, what's weird is that you hinted on this about yoga. If you look at like the average age of a very active person, one thing that you see in a common thread is the flexibility. It's about being
Right.
flexible. You have to be flexible because it reflects on your other connective tissue, like your epithelium and your blood vessels. You don't want to have the hardening of those vessels because that turns out to be bad things, at the end. So flexibility is very important. Like strength, yes. Flexibility, I forgot to mention that, but yoga, you're doing a fantastic job. Getting your flexibility, getting those joints moving because it reflects into your vessels, your arteries and your veins.
Well, it gets your lymph nodes, you get everything gets cleared out in the different moves. I mean, I'm thinking legs up the wall is so good for you. If you've taken a long flight, do legs up the wall and it'll get the lymph going again. And I teach once in a while, I sub for yoga I've had teacher training, and we have an 85-year-old in the class that can do everything.
That's awesome.
It's
Talk,
amazing.
yeah, talking about the long flights and the circulation of your leg, you get that. So they would call that like first leg, I'm sorry, they call that first class syndrome when you fly, when your legs swell up. So
Right.
one of the things that you're trying to do is you're trying to increase circulation and how that's really achieved in a simple way is what you're saying, put your legs up in the air and let the gravity pull
Mhm.
that fluid down, right?
Right.
Now, there's another thing you can do, which is like, I mean, ultimately you want to exercise, but some people can't exercise like a good walk or run. So you want to do a
Right.
cheat way. And the cheat way out there is like a vibration plate, like a power plate. You want that vibration at a low frequency, like 25 to 30 hertz, but that
Uh-huh.
mimics like a good walk run. What you're trying to achieve is a
Okay.
thing called shearing in your blood vessel. When you start shearing the blood vessels, when the blood vessels go up and down, well, it signals the tissue, the epithelium, to release this thing called nitric oxide. Nitric
Okay.
oxide is responsible for the vasodilation. So when you vasodilate, it's just like exercising without the actual compression and jumping. So that is a big secret that's coming out pretty soon about nitric oxide circulation and getting those vessels to move back and forth, you know, dilate, contract. When you're able to do those things, especially after a flight, well, then you get that metabolic waste and all that, that interstitial fluid out of that area by through the lymphatic flow or the venous flow. So That you should try that out too. Is power play at 30, 25 to 30 hertz, 10 minutes.
Uh-huh. That's fascinating. So, what are you working on right now? Do you have something that a project or just continuing the stem cell and the regenerative? I mean, you have an amazing background. I think you love to learn from all the things that you can do in your practice.
Yeah. So right now, I do have Regen, which is the topical transdermal stem cell cream, right? So that is right now on the market. Now the difficulty is because it comes from the umbilical cord, and it's very expensive to get that tissue
Right.
extracted out, and then we have to encase it with lipid nanoparticles, and it's very costly at the very end user. So I'm taking a uh, I'm developing something very interesting that I'll disclose later. But right now, we're going down that
Okay.
process, and where it's very interesting, and the cost would be pretty much a lot more inexpensive than where it's at now. Because these, due to the injection, they cost between $5,000 to $15,000. Everybody knows
Uh-huh.
about those stem cell therapy injections, right?
Right.
Well, in the topical world, you could eliminate that down to about $1,000, $1,200 for the.
Wow, that's
So
awesome.
Yep, so that's a big savings. But now you're going to see even go down further with what I'm trying to do here. I don't want to talk too much about it because
Okay.
I got to protect some of these things. You know how
Yes,
these people out there spying on us. But yeah, so that's
intellectual property.
there you go. See?
Yeah.
So eventually, that's where you're gonna start seeing, something that's very interesting in that world. So yeah, so I'm working on it, developing it, and then doing a lot of research on that, and going to the lab and playing around with it and testing it out. Like, sometimes late at night I'm there with my white coat, no friends, and I'm looking around trying to think like, hey, somebody talking to me out there? But no, 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 it's these cells. It's these cells talking to me. That's what it is.
Well, the observer effect, right?
Yeah. I think I'm longing for friendship late at night, when I'm looking at like these cells, like thinking like, is there's I think these guys are talking to me. They want me to talk and hang out with these guys.
That's funny. So, do you have any, like if someone wanted the topical right now, can they do through telehealth or do they have to be local to where you are?
Yeah, just contact me and then I'll get you a provider close to you that does the product's called Regen, and then they can get
Okay.
that to you and then telemedicine, whatever you want. But just contact me on www.regen.com. You can look at the website and see what this is all about. And then in there it says info or phone number, and just call me up and then I'll point you in the right direction.
Okay, wonderful. And I'll put that in the show notes, your website. And I know you have a YouTube channel too that has different videos that are very interesting for
Yeah,
wellness.
Yeah, so that's so again, I'm a chiropractor, a sports chiropractor. So I have videos on that, and you can see like every condition, and I talk about, how to identify what you have, and then it's a really generic, just a video, and then how to address it once you think that what you have. Um, just in case I forget to talk to you about, you know, Regen is an interesting subject that's very complex. I mean, everybody knows what stem cells, and they kind of have an idea
Right.
what you're trying to do, right? But there's more to it, and then I think with these platforms like these podcasts and AI and all these information you can obtain online, it's really important. So what I've done is that, it's hard to explain over and over the same kind of script, like talking like this is
Right.
what it does, this is where it's from. So that's why I wrote a book about stem cells, and then the evolution is going to turn into the actual topical application. So if you really
Okay.
want to
Is
know what
that book on,
stems,
oh, I'm
yeah,
sorry. Is the book on Amazon?
yes it is. It's on Amazon. Yeah, it's called
Okay,
The
I'll share
Future.
that link in the notes. Sorry to interrupt you.
No, it's okay. But I think that's the big thing is that it's a real easy read. It's about, I don't know, it's like 100 and some pages. But the neat thing about that, there's a science aspect of it, but there's also a layman's version because you'll kind of like walk through. There's a person named Jeff that's gone through an injury, and he's trying to figure out what's the best way to recover himself, and then what are the do's and don'ts, and more importantly, what is regenerative medicine? What are the different kinds of stem cells? Why not this? Why not that? And why are these more of a signal than like a tissue that's supposed to like turn into it, like they call it differentiate? So it's a
Right.
fun book for anybody that wants to understand like stem cell, and then really like what the two like big like there's two groups of people out there that talk about stem cells. So one group
Hmm.
thinks about the word stem cell, live cells, and it differentiates into your existing tissue. So that's group that thinks that those donor sites, they call them umbilical cord, Wharton's jelly, those mesenchymal stem cells, are going to turn into your existing tissue. Then you start to think about, well, in biology, I remember DNA, chromosomes, and those codes, those real codes are ATCG. They turn into something. It
Right.
could be a hair follicle, skin, cardiac tissue, something. It turns into something. Well, how does the donor site have the same code as your existing tendon, ligament? How does it know that? It doesn't. So then you have to say, well, if it doesn't, then why is that differentiating? Why are they saying you need live cells? Well, in my world, there's the other group of people which we look at signaling. We look at these signals from EVs, extracellular vesicles, these cell-free, and then we're looking at the actual information that gives you the ability to turn on your existing tissue. And that's where we're at. We're at the actual, like the signals, and we're trying to obtain that signal from the Wharton's jelly to target your existing tissue to turn on. That makes a lot more sense. And that's why that is more, why would you say, safer, because there's no tumor formation with that. You're just taking the information and then turning on your existing tissue. That's what the fun part is there. So that's what the future is going. So you're going to start seeing the development. And really, what's neat about this, it's getting in the hands of patients, not so much the doctors. So now the patient has command of it because now I have a home application. I can apply it on myself. And then I know based on the science and all the facts out there that it's going to regenerate tissue.
It is a fascinating field for wellness, and like you said, being holistic and empowering the person to be active in their wholeness and their wellness.
Oh, nothing's worse than I'm an extrovert and I have to be outside talking or just running around, and that's how I get my emotions controlled. So the thing with that is that I think about, like, if I couldn't exercise or move because I'm in pain, I mean that's a big detriment to my mental state. So that that wellness is not just the physical side, it's the mental side of it. So,
And the
if
spiritual. I always say it's the whole picture, body, mind,
absolutely.
and soul. Yeah.
Yeah. So, I know that there's people out there that may go into some type of depression. You start looking and goes,
Right.
well, you look at their activity, their activity as far as like a walk, being outside, being physical, because your body likes that, it enjoys that compression of the body, and then the point of recovering. It's like, you want to push yourself, get a good workout, and then recover and then enjoy that, like that euphoric feeling that you get from after a workout or a walk.
It's so true. I just want to thank you. This has been a fascinating conversation, and I can't wait for your new product that you're working on to come out. So you'll have to keep us posted on that. And I'll put your website and all your links on the podcast notes. And like I said, this has just been a fascinating conversation. And I thank you so much, Dr. Rhee, for being on the Healing Soul.
Oh, this is awesome. Thank you very much for the invitation. I love it. And anytime, the future is going to be very promising for all of us.
That's wonderful. And then what's the name of your book?
Oh, it's called The Future of Regenerative Medicine, Unlocking the Potential of Topical Stem Cell Therapy.
Wow, I love it. So it'll be a good overview for people to read, and then, like you said, it was in layman's terms so that they can get a good idea of what it all encompasses.
Yeah, yeah, yeah. Sorry about the long title, guys, but if you just you on Amazon, just put Dr. Rhee, Rhee, and just put topical stem cell or like the future of stem cell or regenerative medicine, it'll pop up.
Perfect. And I always pick an intuitive heart oracle card, and today's is right on. Self-evaluation. Look at your life. Are you where you want to be? What are your goals? How do you feel? Meditate on what's going right in your life and also what needs improvement. Journal both good and bad. Be real with yourself to improve your life situation. Give compassion and love to yourself moving forward. Do a self-evaluation, physically, spiritually, and emotionally. I want to thank every soul listening. Thank you for listening to the Healing Soul, empowering wellness and oneness. Hit the follow button and share this episode with your friends. and know that God loves you and so do I. Thank you.